We're talking about neurogastroenterology and the impact Mayo Clinic has had in this field over 100 years. It's quite amazing what Mayo Clinic's contributions have been, and it was a real pleasure to summarise some of this in this editorial for the Proceedings. Hello, I'm Nicholas Talley. I'm a neurogastroenterologist. I have worked at Mayo Clinic both as a research fellow and on staff. I'm now based in Australia at the University of Newcastle and the Hunter Medical Research Institute. The article that I'll be talking about today will appear in Mayo Clinic Proceedings. I was very pleased to do it with my esteemed colleague, Dr. Michael Camilleri. The article is entitled Mayo Clinic Proceedings in the Last Century, Seminal Contributions by Mayo Clinic Physicians and Researchers to the Field of Neurogastroenterology. Neurogastroenterology is the study of the gut-brain axis, which we know is incredibly important, not just in gut diseases, but in all sorts of other disease, including neurodegenerative diseases. So this is a very important field of endeavour, and neurogastroenterology is growing, which is really a wonderful thing to be part of and to see happening. As I said, Mayo Clinic has had marvellous contributions, and I'll just summarise a few of these here, just so people are aware of what we talked about in the article. Dr. Charles F. Code is known as the father of gastrointestinal motility, and he was a Mayo Clinic consultant in the Department of Physiology early in the last century. And he made very significant contributions to the field, including the identification of esophageal motor disorders, which we still largely use today in our clinical practice, but he contributed to all sorts of other areas in the field. Dr. Code, for example, discovered the role of histamine and talked a lot about this in his work. One of the proteges of Dr. Code was Dr. Joseph Krzyzewski, who discovered the migrating motor complex in the small intestine, what's known as the intestinal housekeeper. So enormous contributions by Dr. Code to our field very early on. And he overlapped with another very famous gastroenterologist, really another, in my view, father of neurogastroenterology, and that is Dr. Walter C. Alvarez. And Dr. Alvarez really made seminal contributions to the field of study in irritable bowel syndrome, including recognizing this was not just a colonic disorder. And he also invented electrogastrography, the measurement of gastric electrical activity in the stomach, which has had an absolute renaissance in the last decade or so, and looks like it will be a very important piece of our diagnostic armamentarium going forward. There have been many others, though, who've made significant contributions. There was Dr. J. Arnold Bargan. He actually was a past president of the AGA, and he also discovered diabetic diarrhea, which is a very important entity, of course, for those who suffer with diabetes. Dr. Alan Hoffman was another Mayo Clinic consultant who worked on bile acids and really opened the door to the role of bile acids in gastrointestinal diseases, which has led down the track to a number of drugs which interact with the bile acid pathway in terms of new treatments. So again, an important contributor to the field. And then there was the work on motility disorders by Dr. Sidney Phillips and Dr. Juan Malagelada, as well as others. And they really pioneered the role of gastroduodenal manometry, still used today at Mayo Clinic in diagnostics. Dr. Phillips also worked with one of our colorectal surgeons, Dr. John Pemberton, and they contributed significantly to the field of constipation and anorectal manometry evaluation, which of course has led lately to biofeedback being much more widely applied for constipation disorders. So that's another critical set of contributions. There have been many others. I think part of the success of Mayo Clinic's work in neurogastroenterology has been its collaborative focus. For example, work with the neurology department, Dr. Philip Lowe is one example, where the role of autonomic neuropathy in gut disease has been looked into very effectively, again leading to advances and understanding of new syndromes and problems of the gastrointestinal tract and the neurological system, which we see in some of our patients with these difficult disorders. Finally, the actual term neurogastroenterology is a term that was actually used by Mayo Clinic consultants in the 80s and early 90s. And this actually led to a change in the field's focus, really, and name as well, from just motility to neurogastroenterology. And I think that's a reflection of the excellence of contributions by many Mayo Clinic consultants over time. Dr. Camilleri and I were very fortunate to be actually mentored by Dr. Sidney F. Phillips, who was the head of the Gastrointestinal Research Unit and really a leader in GI motility and neurogastroenterology when we were training. His mentorship, his inspiration really has been something we've very much valued over our entire careers, as have hundreds of other experts who trained at Mayo Clinic, did research there, and then moved back to their home countries and have been leaders in their field internationally. So Mayo Clinic's got a lot to be proud of in terms of neurogastroenterology. Well, thank you very much for having me for this recording.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.